Hi, my name's Joe. I've been living with diabetes for 14 years.
Hi, I'm Sarah Colbert. I'm a registered practical nurse, and I help people prevent foot and lower limb complications in my clinic.
Hi, my name is Oscar, and I have been living with diabetes for 11 years, and I am here to answer the most commonly searched questions about diabetes.
And today, I'm here to answer some of the most commonly searched questions about diabetes.
And I'm here today to answer the most commonly asked questions about diabetes. Okay, who is at risk for diabetes? It was thought that people that are overweight and obese would be at risk for diabetes, but really anyone is at risk. Who invented insulin for diabetes? Not to be confused with who invented insulin for migraines?
Insulin is invented by a doctor in Toronto from the University of Toronto. His name was Sir Frederick Banting, and that was, I believe, in 1921.
He was knighted for his discovery, which is fantastic. It's helped millions of people.
Who in Hollywood has diabetes? I think Tom Hanks has diabetes.
That's a very good question. I don't know of anyone in Hollywood who has diabetes. I also think that has something to do with the fact that some people don't want to disclose that they're diabetic.
What is neuropathy? Neuropathy is nerve damage to the legs, which can often cause numbing or tingling and weakness in the affected areas. What is the difference between type 1 and type 2 diabetes? Type 1 can't produce any insulin at all, where type 2 diabetes can produce insulin, but their body doesn't use it very well. What are some common misconceptions about diabetes? Some common misconceptions are that if you eat too much sugar, you're going to get diabetes, and you can, but sometimes other misconceptions are that everyone is overweight if you're diabetic, or that you have to inject insulin every day. What are some risks associated with diabetes? So with diabetes, some of the risks can be cardiovascular disease, high blood pressure, nerve damage, blindness, and amputation. What is the difference between non-binding and compression socks? Non-binding socks are looser around the legs. They don't have an elastic, so they don't create marks around your legs. And compression socks are apply pressure to your legs where it helps increase blood flow. Both socks work pretty well. It just depends on you, and you should speak with your medical professional to see what's right for you.
Why should I take my diabetes so seriously? Well, diabetes affects quality of life. So if I want to enjoy my life for as long as I'm alive, I always have to pay attention to what it is that I'm doing, whether it's exercising, eating the right type of food, eating the right quality of food. The better I do with those things, the better my quality of life will be.
Why is foot care so important for people with diabetes? Well, foot care is important because you want to prevent foot and lower limb complications, such as wounds, nicks, and cuts that could possibly lead to infection, and then even amputation, if not cared for. So it's very important for people with diabetes to take care of their feet. Why should I care about the socks I wear? Diabetics should care about the socks they wear because they want to prevent lower limb injuries to their legs and feet. So you'll want to find a sock that is non-binding, has a seamless toe, that's not constricting to your legs, that's very stretchy, and that has great breathable material.
Is diabetes common? Diabetes is quite common. It's about 10% of the population, which is quite high. Is diabetes hereditary? Some people say it is. It can for some people, although some people can become diabetic whether there's no diabetes in their family at all. Is there a cure for diabetes? I would think this is kind of a controversial question. I don't think there's an actual cure for diabetes. In fact, there isn't. However, some people can manage it quite well and without medication. Is insulin resistance the same as diabetes? Insulin resistance can be the same, although insulin resistance often may lead to type 2 diabetes. Insulin resistance is when your body doesn't use the insulin as it should. Who's the fact checkers here?
How can diabetes affect a person's day-to-day life?
If a diabetic is doing everything that they're supposed to do, they should have a normal life just like someone who doesn't have diabetes. So eating proper food, eating the proper amount of food, exercising regularly, you should be fine.
Diabetes can affect a person's day-to-day life in a financial way, social, emotional, and physical. Let's take financial as for example. So financially, diabetic Lancets, let alone test strips, can be very expensive for some people. Therefore, they're not able to test their sugars on a day-to-day level. It could leave them emotionally frustrated because of that. Physically, they'll feel awful because maybe their sugars are too high or too low, not allowing them to want to be able to feel like they want to socialize with people.
How can diabetes affect the people around you?
It can change your family dynamic. So let's take into consideration food or your diet, for example. So maybe you're a family that likes to eat high-fat foods or fried things. And now that you have diabetes, you'll have to change that a little. You'll need your family on board, where your family is now wanting to say they're supporting you and it's changing the way they used to cook these things. It should be a family-oriented goal that you should do together.
How can I learn to live with diabetes? There's lots of ways to get information about diabetes. Your family doctor, books, some things on the internet. But there's lots of tools that are available for you to lead you down the right path for looking after yourself if you're living with diabetes. And I know, because I live it.
How can someone with diabetes care for their feet?
Good question. Having a good quality sock is paramount for your daily activity when you have diabetes, but also daily when you're having a shower, bath, whatever, putting your socks on to just check your feet, make sure that there's no cuts, blisters, sores, anything like that. If you find that there is, it might be an idea to talk to your doctor about it, but a good quality sock is probably the best thing to start with.